The acetic acid test. The substances held in suspension in the urine are organic and crystalline. The former, pus, blood, bacteria, etc., form the object of the clinical examination, while the latter, crystals, though of considerable importance in the general diagnosis, are only confusing here. Their presence simply obscures the undissolved organic content of the urine. Now, of the various crystals that may cloud the urine, the earthy phosphates are the commonest and the most important. Urates and uric acid are rarely seen in any quantity in freshly passed urine, and their reddish color distinguishes them. Oxalates or cystine scarcely ever occur in such quantity as to cloud the urine, but the phosphates are common and readily soluble by acidulation of the urine. Therefore, if examination of the urine in 2 glasses shows that both are cloudy, for the phosphatic cloud appears in both urines, the glass containing the second urine is held against the light and a few drops of acetic acid poured down its side. Footnotes. Number 1. I have several times seen an oxalate cloud, once a cystine cloud. They produce the same opalescent haze as do phosphates or bacteria and are distinguishable only by the microscope. 2. When the phosphates are in great excess, they are not distributed evenly throughout the urine, but, having settled in the bladder, are most concentrated in the last drops. In extreme phosphaturia, this concentration of crystals in the last drops is so marked that the patient can occasionally squeeze from the urethra little gritty masses of phosphates left there after urination is complete. The characteristics of this phosphaturia, as it is called, are the following. It occurs almost exclusively in youth between the age of 15 and 35. It is apparently due to a functional disturbance in assimilation and is therefore commonly seen in young persons who work with their heads rather than with their hands, is often associated with functional dyspepsia, and like this is most marked at periods of mental stress. It never causes stone or inflammation of the urinary passages, and its association with pus in the urine is purely accidental. Its chief clinical characteristic is its sudden appearance and disappearance. At one micturition, the urine is milky with phosphates. At the next, absolutely sparkling and clear. Its prognosis is good. It gradually lessens with age. It does no harm. The sexual neurasthenic, of course, looks upon it with horror, and for the mental relief of such persons, treatment of the phosphaturia is required. First, one should insist that the phosphaturia is harmless in itself and only a sign of functional derangement. Secondly, one must insist upon a strict regime of diet and exercise appropriate to the existing nervous or digestive disturbance. Thirdly, one must remember that a direct attack upon the phosphaturia by drugs is usually a failure, and if successful, is only of temporary efficacy. Hexamethylenamine, Salol, benzoate of soda, and other urinary acidifiers have a reputation beyond their merits. 10 drops of dilute hydrochloric acid before each meal I have found more efficacious than anything else, but our main reliance is hygiene, especially as to diet and exercise. If phosphates are present, there follows instant effervescence from the breaking up of carbonates that are always associated with phosphates and clearing of the urine. This clearing may be interfered with in only 2 ways, viz., by the presence in the urine of insoluble substances, crystalline or organized, the nature of which must be determined by microscopic analysis, and by the presence of copaiba in the urine. The urine of a phosphaturic patient taking copaiba clears only for an instant and then becomes cloudy again, the copaibal cloud being only a little less opalescent than the phosphatic cloud which it replaces. When, therefore, we know from previous microscopic analysis the nature of the insoluble substances in a patient's urine, and know also that he is not taking copaiba, the acetic acid test is used as the simplest method of removing a chance phosphatic cloud as a routine preliminary to the clinical examination of the urine.